He's going to talk about how we can treat the patients that we cannot treat here because we think it's appropriate for them to have another treatment elsewhere. Bob?
Good morning. Thanks to Dr. Reed for inviting me to talk about the out-of-country program. I feel obliged to preface my remarks a little bit. The Ministry of Health and Long-Term Care spends almost $40 billion a year on health care in Ontario. The budget for the program that I am in is less than 0.5%. So it's a very small program, but I think it's an incredibly important program. It's an escape valve for a system that's often stressed and has very little reserve capacity. Under the terms of the Health Insurance Act, and we have to very strictly interpret the Health Insurance Act, Ontarians can access funding for out-of-country services anywhere in the world without regard to how much it costs. Part of the mandate of the out-of-country unit is to negotiate the best possible costs, but that's beyond anything that the Ontario patient has to worry about. So I've come to realize that the out-of-country program is a pressure valve for a system that's often stressed. When we see a number of applications for funding for a particular service, be it stem cell transplants or bariatric surgery, if the number of applications continues to grow, then we realize that there's a problem with that service in Ontario. And we draw attention to those who can make some decisions about increasing capacity within Ontario. We all agree that the best way to treat Ontarians is in Ontario. But for reasons that were alluded to before, we can't possibly provide all services to all Ontarians. And so the out-of-country unit can take applications, see if it's in accordance with the Health Insurance Act, and if it is, we can approve funding for those services. There will be a handout, and it's going to cover all of these slides. You can pick that up after the talk. The overview of presentation simply is like a table of contents and tells you what the slides cover. Try to give you some context of health services within Ontario, out of province, and out of country. Anybody who's a permanent resident of Ontario and has lived for a minimum of 3 months in Ontario can apply for an individual health card, and that card can access services within Ontario that are fully funded. It can also access services that are not insured but are still funded by the Ministry of Health. There's some examples there, and other examples are the Northern Health Travel Grant, physiotherapy in long-term care homes, services through Cancer Care Ontario, and the infamous PET scans. PET scans are not insured in Ontario, but they can be accessed. Out of province, we do have interprovincial agreements with other provinces and territories, except Quebec. And people can access health services across the country, but it's not an even system. You can't go to a private clinic in BC and have that reimbursed by Ontario. The only private clinic services that are reimbursed by Ontario have to do with dialysis. If you receive physician services in another province, the physician may or may not have signed on to the interprovincial agreement. If they have, you have nothing to worry about. The physician submits the bill to your home province, and it's invisible to you. Same with publicly funded hospitals that have signed on to interprovincial agreements. But if you go to a private hospital, you'll have to pay for it and then try to get some money back from Ontario upon your return. It's worthwhile having a look at the Ministry of Health website and learn more about services across the country. It's not as simple as the Canada Health Act allows you to access health services evenly across the country. It just isn't so. That brings us to out of country. If you're traveling out of country and you have an illness, disease, condition, or injury arise out of Canada, and it's unexpected and was not part of a pre-existing condition, then you may be able to access minimal amounts of reimbursement when you return to Ontario. But it is a terribly small amount of money. $50 per day for outpatient, $200 per day for a low level of hospital care, and $400 a day for something like cardiac care or intensive care or surgical services. It's not going to come close. The United States charges us around $6,500 per day for hospital care. And that's what you'll be charged, and hopefully you'll have travel insurance to cover the difference. Now we come to what we call the out-of-country program in red. There's two parts to it. If you have an emergency that arises in Ontario and requires that you be transferred out of country for treatment because it's life-threatening and there either is no service available in an Ontario hospital or there's a delay, then you'll be transferred by ambulance to a U.S. facility. That's all fully funded. The second part of the out-of-country program is by prior approval. These are for elective services, and it requires an application and the processing in accordance with the Health Insurance Act. So on behalf of their insured patients, and you must have a valid health card at the time, and it's amazing how often people will allow their health cards to lapse for whatever reason. So again, pay close attention, make sure that your health card is valid at all times and keep it with you. So Ontario physicians can apply for full funding of out-of-country health services as long as they're performed in a licensed hospital or licensed health facility, not generally accepted within Ontario as experimental or for research or for a survey, generally accepted in Ontario as appropriate for those medical circumstances, and either not performed in Ontario, but they are available. However, the delay will result in death or tissue damage. This is all part of Ontario law, and no one working in the out-of-country program is permitted any discretion outside Ontario law. It is, that the title of the application is Prior Approval Application for Full Payment of Insured Out-of-Country Health Services. All those words are important. It is a prior approval process. It has to be adjudicated before the services are rendered. The funding letter that goes from the ministry that outlines exactly what is insured and what is funded is specific to those services. It has to be received before you receive any of those out-of-country services. There are some people who believe as soon as they submit the application, they can take off to that out-of-country facility and they'll be reimbursed afterwards. That's just not true. I'm going to save my voice a little bit. I'll let you read through that one. There's been a huge increase in the number of applications. We dealt with almost 9,000 applications last fiscal year. That was a 4.5 times increase compared to 2001 when I joined the program. That means that you would get on average about 40 applications per day, but they don't come in on average. Sometimes we'll receive 100 in a day. It's very difficult to process that number. It keeps us extremely busy. You can see that 95% are approved. Only 5% are denied. Again, it's not a random denial. It's denied in accordance with the legislation. People have the right to appeal that decision, but when it does go to formal appeal to the Health Services Appeal and Review Board, our decisions in the out-of-country unit are reinforced better than 95% of the time. The HSARB also has to interpret the legislation in the same way that the general manager of OHIP does. They don't have any powers to change or to give people money for compassionate reasons. There's still no discretion. Ontario has almost 13 billion population. Million. BC 4.4 and Alberta 3.5 million. So just to give you some context again, we get one application for out-of-country funding for every 1,400 citizens. BC, they receive one for every 3,000 of their citizens. Alberta, one for every 41,000 of their citizens. It's a very active program. Again, I'm going to let you read through this one. A very large number of our applications have to do with DNA testing. Services that are not eligible, and many feel that this is a deficiency in the out-of-country program. Obviously, people who are sick and who have to travel some distance need to have a companion. They have to they have to arrange and pay for travel, accommodation, food, and so on. None of that is covered by our program except if it's part of inpatient insured services. Certainly not for the companion, though. Again, experimental research, survey, health services, drug trials, they're not covered. And it's worth mentioning that any WSIB case cannot apply to the out-of-country program because they are covered through a different act. They are not covered through OHIP funding. I brought along examples of application, but I wouldn't pay too much attention. I'm going to have them at the back of the room for people to have a look at. But they're changing. We're making them more specific for the health service that people are applying for. And so it'll be changing within a few months. The second point, the referring Ontario physician, not the patient, must complete the application. That's not to say that patients should not be part of this process. It's simply, again, part of the legislation. Which reads, an application for approval of payment must be submitted to the general manager by a physician who practices medicine in Ontario on behalf of the insured person, and the application must contain a written confirmation from that physician that, in the opinion of the physician, one of these preset conditions is satisfied, and those I reviewed before, that it's generally accepted as appropriate, that it's not performed in Ontario, or it is, and there's a delay that's going to result in death or tissue damage. So it has to be the physician, and it's very frustrating for us to call up physicians and say, on what do you base your opinion? And they say, I don't know. Well, why did you fill it out? Well, I didn't. I just signed it. That leads to all kinds of delays. It doesn't mean that ultimately it won't be approved, but I'll tell you, it's very frustrating when the applying physician really doesn't know anything about what treatment he or she is prescribing. So our advice to physicians, we call it physician responsibilities. They are hints to, I should say that our legal department, because we do have a legal services department that we work very closely with, is very fond of saying that if the application is in accordance with the Health Insurance Act, OHIP wants to fund it. It's not an adversarial program. We want to fund it, and we don't pay any attention to how much it costs, but there is a part of our unit that's tasked with negotiating best possible prices. Because as many of you know, particularly south of the border, there's Medicaid, Medicare, what major insurance companies pay, and basically what the hospital would like you to pay so that they can pay off some of their debts and capital costs and expansion costs and state taxes and so on. There's a lot of room for negotiating, and we have to because we're spending money that's part of the public purse. So we suggest to the Ontario doctors to do some research. It doesn't take an awful lot of time. And it's actually quite enlightening to call up people like Dr. Reed and learn about a program that is so highly subspecialized. So we do want the patient to act as a resource for his or her doctor. We want the patient to encourage the doctors to communicate with the out-of-country unit, with the medical consultants like myself. We do want to receive a completed application with as much medical documentation as possible And particularly, we want people to remember to purchase additional insurance, because what you are funded for is what's on the application. What happens if you're in a car accident on the way to that facility in the United States is beyond the scope of the out-of-country program. So you want additional travel insurance to cover any eventuality like that. The question that people ask us when they submit an application is, how long will this take? What kind of bureaucracy am I going to run into? If we have a completed application with all the necessary medical documentation, we can turn it over in less than a day. But sometimes it takes an awful lot longer than that, because often there's exchange of faxes asking for additional information, getting in touch with specialists about whether this is truly generally accepted treatment in these circumstances. I mentioned earlier that excluded from insured services are experimental services. Experimental is not defined in the legislation. So we have to go to Ontario experts to see what they understand by the term experimental. And often it requires multiple Ontario experts, and sometimes we have to set up expert panels. For example, I mentioned stem cell transplant. There's a huge variation in transplanters' understanding of what is experimental and what isn't. So we do try to facilitate the process. We do try to identify more urgent applications. We do provide contact numbers to the out-of-country unit, to the website, a fax line. These are toll-free phone and fax lines. Email inquiry line. We send out bulletins to 25,000 Ontario physicians. One was sent out the 29th of October last year, and another the 1st of April this year, informing them about the out-of-country program, and yet it's amazing how many Ontario physicians do not know about the program. So that's where patient advocacy comes in. We're counting on people to learn about the program, visit our website. It's extremely informative. There are links to many other interesting health services available in Ontario. So we would never suggest for a moment that patients should not be part of the process, just the opposite. However, when it comes to making out that application form, the Ontario physician has to take responsibility for making some of those decisions. The approval letter, when funding is approved, is extremely specific. And this will be after we've done some negotiations with the out-of-country facility. So anybody who receives that letter should read it line by line, word by word, extremely carefully to make sure they know what is funded. If you go beyond what is funded, because if you walk into a major hospital in the U.S. and you have some sort of diagnostic dilemma and you're there for a couple of consults, there are notorious facilities that will, by the end of the day, have you see a dozen consultants and have innumerable tests within the course of a week. You're not funded for it unless the funding letter says so. So you're responsible for the difference in cost. And that can be tens of thousands of dollars. What happens when people are out of the country? They've had approval for having some health services, and the out-of-country facility says, well, we have to do these other things. What you've approved is not sufficient. The Ontario physician then has to get involved. The out-of-country facility has to be in touch with the attending Ontario doctor explain what's medically necessary, and if the Ontario doctor is in agreement, then that doctor has to submit in writing what those services are, and has to basically go through a reapproval process, not for the whole thing, but for the additional services. Again, without the hospital receiving, and you as the patient receiving, a letter from the ministry approving these things, the ministry has not accepted responsibility for payment. So what can you do if your application is denied? You can submit more medical documentation yourself or your attending doctor or both. We're willing to look as many times as necessary at additional information to re-adjudicate the application. So that's what we call an IRP, an internal review process, with an internal review panel. And each time we try to get different people to review it, different medical consultants to review it. Should you choose not to follow that process, you can appeal directly to the Health Services Appeal and Review Board, the HSARB. That's a quasi-judicial body. It's a formal process. And you can submit all your documentation, and you can make your case to the HSARB by telephone, in writing, or in person in Toronto. As I say, the HSARB can't interpret the legislation any differently than the general manager, but once in a while they do disagree with our decisions, about one time in 20. So it's a worthwhile process. One of the most worthwhile things to do on the way to that formal appeal is to request pre-hearing conferences by telephone. We've had some, I think the record is something like 34 of them for a single case, where there's exchange between, at that time we called the patient the appellant, so between the appellant and the respondent, exchange of information to try to make the process as easy as possible. Thank you. Do you have any questions?
I want to ask a question regarding recovery of costs without prior application, without prior approval, and also in regards to future treatment approval under the following conditions. Let's say the conditions are as follows. You're discharged from a specialist here. There's no referral out of country. The specialist's opinion may be that no further treatment is permitted or of value. Family physician can't help you because they don't have an opinion. And further delay could lead to further serious complications or even death. But at the same time, you are approved for treatment abroad by three or four centers.
Who has done the approval?
The treatment centers overseas in Europe.
Okay.
They're well-known treatment centers.
We're talking about a mechanism for funding. And so people are quite free on their own to go and seek health services anywhere they want in the world. However, to be funded by the Ministry of Health, you have to go through a prior approval funding process.
So there is no recourse, in other words, if you have not received prior approval. Is that...
You can always appeal, but your chances of being successful in that appeal are none.
Does that have something to do with the Canada Health Act, or...?
No. No, this is an Ontario program.
So it's the Ontario regulatory framework, in other words?
No, it's the Health Insurance Act of Ontario.
So,
It's Regulation 552 of the Health Insurance Act. It is available online for people to read. I tried to hit the highlights of it.
We're really behind now, so I'm afraid we can't take any more questions.